Hello and welcome to the December 2023 edition of Room for Everyone, the video podcast of the Rheumatologist. Today, we're going to talk about empathy and the vital role of empathy in maintaining the patient-clinician relationship. In this day and age, we hear about empathy everywhere. We are told that it's important to be empathic and, more importantly, to show that empathy to our patients. We are instructed to signpost our empathic responses to let patients know how much our healthcare systems care about their customers. As clinicians, we can do one better. We can grow our empathic skills and form stronger, more authentic bonds with our patients. And in the process, we can make sure that our professional lives are filled with the sense of wonder and satisfaction that only comes with service. In turn, our healthcare systems will also benefit from the higher patient satisfaction scores. But to get to that point, we have to learn a little bit more about empathy. So let us start by recognizing the three different types of empathy, at least the three that were identified by the preeminent psychologists Daniel Goleman and Paul Ekman. These are cognitive, emotional, and compassionate. The first, cognitive empathy, is a form of perspective taking. It requires using our imaginations to construct a better understanding of what another person may be thinking and feeling. The second, emotional empathy, is the ability to respond with an appropriate emotion to another person's mental state. This means reflecting the emotions of another person as if they are, because they genuinely are, equal and worthy of our emotional investment. And the last is compassionate empathy, the drive, the very impulse to help others out of a sense of common and shared humanity. These three forms of empathy, cognitive, emotive, and compassionate, are only scratching the surface of the many different types of empathy. More recently, experts like Elizabeth A. Siegel have talked about social empathy, the capacity to more deeply understand people by perceiving or experiencing their life situations, and as a result, gain insight into structural inequalities and disparities. We rheumatologists play an important role in fostering this empathy and role modeling it for others. Empathy makes our lives richer and our experiences more memorable. It's been long known that we seek meaning in the world around us. Seeing and embracing empathy creates that higher, more holistic sense of meaning, and in the process, remakes our world to be kinder and more equitable. There's a lot of other great articles within the pages of this month's issue. What are the new guidelines on the timing of elective knee or hip arthroplasty? Can cannabis be utilized for relief of chronic pain? How has the ACR's Committee on Rheumatological Care made rheumatology an ever more thriving field? Who comes up with the reimbursement values for relative value units, those darned RVUs? And why is it important for patients with rheumatic diseases to engage in physical activity? That and so much more in this month's edition of The Rheumatologist. So, please enjoy. Take a seat. Make yourself comfortable. After all, here at The Rheumatologist, it's one for all and room for everyone. Happy holidays and happy reading. Take care.